Hello, this is Dr. Daulton from Hammond Chiropractic, and in today's video I have something really special for you that I want to talk about. This was so interesting to me. I was actually reading a research article. I'm going to read the title to you, but then I'm going to explain it because if you're not used to reading this type of thing, this isn't going to make any sense. But this study was published in the Journal of Manipulative and Physiological Therapeutics, and the title of it was Effects of 12 Weeks of Chiropractic Care on Central Integration of Dual Somatosensory Input in Chronic Pain Patients, a Preliminary Study. I know, it's a lot, right? But let me tell you what was so fascinating about this. Basically, what they did in this study was they took people who have chronic pain and they put them through 12 weeks of chiropractic care to see what the end result is. And let me kind of give you the background on what happens to a person who is experiencing chronic pain. And by the way, they also discussed that this doesn't just happen to people with chronic pain. We also see the same thing that I'm about to describe to you happen with people who have autism, Alzheimer's disease, depression, schizophrenia, and attention deficit hyperactivity disorder. So basically what they find happens is this. You have to kind of understand how your nervous system works a little bit before I explain the rest of this. So your nervous system is composed of three parts, and I've talked about this many times on my videos, but let me just kind of go over this again. The number one most important part of the nervous system is the brain. Of course, that's where everything starts. Off of the brain comes the spinal cord, and that lives inside of your spine. All right, the spine protects the spinal cord. And then off of the spinal cord come the spinal nerves. And these nerves, they travel out to all the different parts of your body. And the way I think of it is that the brain is kind of like the source of the power or the electricity or energy that runs the body. And so what's happening here is that when something happens inside of you, no matter what that is, it all starts in the brain, and then the brain sends a signal down through the spinal cord, out through these nerves to all the different body parts, and that's what controls how everything functions. Now, what we also know, though, is that your nervous system isn't just a one-way street. We talk about it in this way a lot with chiropractic because what we are doing is we're looking for a problem called subluxation, and let me just kind of show you what that is in case you've never seen my videos before. But if you look at the spine up close here, the way that this works is you've got the bones stacked on top of each other. You have a disc between each set of bones, which is like a cushion, and if I turn this to the side, the nerves are exiting the spine between every set of bones here. And so what can happen is that these bones can sometimes misalign. And when they misalign, what they do is they put pressure on that nerve, and that stops that flow of electricity through the nerve out to the body. And so whatever that nerve is going to will stop functioning the way it's supposed to. So a good example would be if that nerve is going to my heart and it's applying the electricity that my heart needs in order to work the way that it's supposed to, my heart is going to start to have problems eventually because it's not getting the full energy that it needs in order to work the way it's supposed to. If that nerve is going into my leg, I'm going to start to have pain shooting into my leg. I'll start to have problems walking because these nerves are controlling the functioning of the leg. In the lower back, there's a lot of other things that happen too. For example, those nerves will go to the bowel and the bladder. So you might start to lose control of the bowel and bladder function. So a lot of different problems can develop, all because you have pressure on these nerves because these vertebrae are misaligned. And what a chiropractor does is that we find where this is happening, we call it a subluxation, and we actually do something called adjustments, which will realign those vertebrae and get the pressure off the nerve so that the nerve can start working again, and therefore the body starts working better like it's supposed to. Well, what also happens is that, like I said, this isn't just a one-way street. It's not just the brain sending electricity out through these nerves. There's also messages coming from out in the body through the nerves up to the brain so that the brain constantly knows what is going on inside of your system. Well, what we know with chronic pain, as well as some of these other problems that I just discussed, is that when we have an injury of some kind and something in the body is damaged, what happens there is that your body releases chemicals. Let's say I hurt my hand. And so the body's going to release chemicals that the nerves are going to pick up on in that area. They're going to send a message back up to the brain that says, hey, something is wrong here. So you now sense pain, which is your signal that something is not right and you need to get it taken care of, all right, or you need to treat it somehow. Well, what happens with chronic pain is that normally when this heals, those chemicals disappear, the message stops getting sent to the brain, and now the brain knows everything is okay, so I don't have to feel pain anymore. With chronic pain, that doesn't happen. So even if something physically gets better, it continues sending messages to the brain constantly saying, hey, I'm in pain. Hey, I'm in pain. Hey, I'm in pain. So a person who experiences chronic pain, whether there's something physically wrong or not, their brain keeps perceiving that there's something wrong, and they live in constant pain because of that interpretation of the brain, all right? And what they found is that with chronic pain and with these conditions, because of that constant stimulus going up to the brain actually shrinks in size. Because what's happening there is that the body or the brain is constantly focused on this pain stimulus, or the sensation that there's pain happening in the body, that all of the other functions stop being focused on, and the brain literally shrinks in size. And what they're saying is that this is the reason that we get additional symptoms with patients who experience chronic pain, things like depression and anxiety, sleep disturbances, decision-making abnormalities, and in my case, what we look at is body function. The body stops functioning the way it's supposed to, so it leads to a lot of other problems, like problems with walking, problems with writing, or using their hands and arms. So these are the types of things that we see because that brain is shrinking and you're not using all those different functions that you're supposed to be using on a regular basis. So what they found in this study was that when they took a patient who was experiencing chronic pain and they put them through 12 weeks of chiropractic care, it actually slowed this process down and stopped those messages from being sent to the brain constantly. And so the people experienced not only less pain, but they also experienced better functioning and all the things that I just discussed. So they were able to use other parts of their brain that they were not able to use before because the pain was the constant focus for those patients. All right. Now, does that mean that this is going to make all the pain go away permanently? No. You have to understand something. When a person starts to experience a problem that they have for a long period of time, and by the way, I probably should define that for you. Chronic pain means that the person has experienced it for a long enough period of time that now it's basically become permanent, okay? It's a very, very difficult thing to work with, and I'm not saying that chiropractic is the only thing that you should be doing if you do suffer with chronic pain or with one of those other conditions that I just mentioned there, but I will say this study shows that chiropractic should be a very, very important part of your treatment protocol in order to assist with this, because it's going to help you function better and it will help you deal with the pain better. So what they found was these patients not only experienced less pain, but they experienced better function. But why is it that the pain doesn't completely go away even when they've gone through that much care or they're doing other treatments as well, like using medications or whatever the case may be? And the reason is because of how these injuries develop. And I've talked about this on other videos before, but I want to repeat this for you just so you kind of have an idea about what is really going on here. So let me erase my little guy here, and then I want to draw another drawing out for you and just explain how this actually works. So the way that I explain this to patients is that when you have an injury, typically, or let's say when you have a symptom, no matter what it is, it could be back pain, neck pain, whatever the case may be, headaches, it typically doesn't develop right when you start to feel it. So I like to draw this graph out for people, and so we're going to draw a line here. We're going to call this optimal health, all right? That means that everything in your body is working the way it's supposed to. You feel really good. You've got energy. Everything is going the way that it's supposed to, all right? But what ends up happening to us is that we have injuries that happen to us throughout our lifetimes, and these things start in childhood. So let's say we have a slip and a fall. Let's say we have a car accident. Let's say we play sports and we get injured in our sport. All of these different things add up, but we don't feel it along the way. And the reason that we don't feel it along the way is because every one of us has a pain threshold, all right? What that means is the damage has to be bad enough that it actually hits your pain threshold. If it doesn't hit your pain threshold, you're not going to actually feel like anything is wrong at all. And we see this with a lot of different conditions. This is the reason that heart attacks typically happen without any symptoms, letting you know that there's something wrong with your heart. Cancer develops the same way. The body doesn't let you know that something's wrong until it's overwhelming it and it's too much for the body to actually try to handle. So there's a lot of different conditions that develop in the body without us having any sort of a warning that something is wrong. And the same thing happens with pain. Now typically, Depending on how bad the damage is at this point, what we do with the patient is we work with them with a series of visits, with the goal being to get you first over your pain threshold, and then what we do is we continue, because our goal is to try to get your spine as stable and strong as possible so that the problems don't keep coming back over and over again. Now that sounds great, right, on the surface, but there are certain people where the damage becomes permanent. And this is the case in these situations where we're talking about with chronic pain, where they're always going to have a certain level of pain. It may get better, but typically they're still going to kind of live in this area here. So at that point, because I deal with a lot of patients on this level, people say, well, what's the point of me continuing with this if I'm still going to be hurting? And here's what you have to realize. Your body does not stay the same ever. It is constantly changing. It's either getting better or it's getting worse. Now I want you to think about something. If you are suffering with pain, whether it be minor or severe on a regular basis, but you decide not to do anything about it because you think, what's the point of doing something if I'm going to constantly have pain? What do you think is actually going to happen? Do you think it's going to stay the same? Do you think it's going to get better on its own? No, here's what's going to happen. It's going to decline. It's not going to stay like this. It's going to start to drop. The longer you let it go without any type of maintenance whatsoever, the harder it's going to be to ever bring you back to a certain level of function or improvement. So I always tell patients, if you're suffering with chronic pain or you have a condition where there's a permanent factor involved, you have permanent damage that will never be 100% perfect, you can't just let it be. You can't just hope that it's going to get better, because it's not. You need to try to at least maintain yourself where you are. And that's actually what we find with chiropractic care, is that a lot of times, even if you deal with some level of pain or a symptom on a daily basis, at the very least, if we maintain you, we can keep it from getting worse. You know, think about this. If I have low back pain that doesn't completely resolve, meaning it doesn't completely go away, but I choose not to do anything about it because I don't think that there's a point, right? Are you going to be able to handle that problem getting worse to the point where you can't walk, where you have to use a cane or a wheelchair or a walker? Because that's what you're facing. It's not just about how you're feeling anymore. You got to think about function. Function is really where it's at. And I had read a study once, which I thought was great. It was talking about how people are living longer now. But the problem that we're running into is that even though we're living longer, the quality of life is lower because our bodies aren't functioning as well for that long a period of time. And the reason is because people don't take good care of ourselves. You don't know how to maintain the body and to keep a certain level of health. And even if you do know, a lot of people just don't want to do it. You know, nobody wants to completely change their diet. Nobody wants to exercise all the time. Nobody wants to go to the chiropractor. And I'm not talking about a lot. I'm talking about just maintaining, going once a month just for a maintenance adjustment to keep these things from getting worse. People don't want to do what they need to do, but I'm telling you, if you do those things, you're going to be so much better off down the road. It's so important that you keep up with your health to the best of your abilities. All right? So anyways, I found that interesting. I hope that you found that interesting. If you are suffering with chronic pain, or you know somebody who is, or if you're dealing with one of those other chronic problems like Parkinson's or autism or other things, make sure you're getting to your chiropractor on a regular basis. I'm telling you, it will make a huge difference in how your body functions and in how you feel, even if it isn't a permanent cure for you, okay? Add chiropractic in is something that you're doing in addition to the other treatments that you're doing, and I'm telling you, it will change your life. It will make things so much better for you. It can just make a huge difference, okay? All right, thank you so much for taking the time to watch this video. I hope you found it interesting, and I will see you next time.